As usual, the arrival of President Muhammadu Buhari into the council chamber kick-started the meeting at 11 a.m. After 3 hours closed-door meeting, Minister of Labour and his health counterpart took turns to brief journalists. The Minister of Labour maintained that government is ready to enforce the no work, no pay rule. According to the minister, the law does not run contrary to the International Labour Organization law.
Emphasize the need for government to implement the law on no work, no pay. The no work, no pay is not a rule, neither is it a policy. It is a law captured in the Trade Dispute Act of the Federation, Section 43 to be precise. It says that workers they have a right to disengage or remove their services from an employer if there's a breakdown in their discussions or negotiations. But for the period that the worker does so, the employer should not pay. And those periods are to be counted as non-pensionable times in a period of work. That's what the law says. So Council today re-emphasized that law is still in situ.
Also arising from the meeting, the Minister of Health said there is an improved response mechanism to tame the outbreak of diseases in the country. Speaking against the backdrop of the recent outbreak of the monkeypox disease in parts of the country, the minister noted that 33 suspected cases of monkeypox disease have so far been reported in 7 states with no deaths recorded. The affected states are Bayelsa, Rivers, Ekiti, Akwa Ibom, Lagos, Ogun, and Cross River.
Many of the cases so reported do not fit into the classic prototype of monkeypox. But then we are trying to confirm before the end of today or early tomorrow. We should be able to confirm what exactly are we dealing with. Is it truly monkeypox? What is obvious is that we have a disease that is close to the pox family.
Federal Executive Council also resolved to implement the policy on residency for doctors in the country.
Council also looked at the issue of residency training program and decided that the training should last for a fixed term of 7 years, and that after training for 7 years, individuals should exit from the program so that other people can come into the program. Council has also decided to look into the issue of private practice by medical doctors in the public sector, and a committee has been set up to look extensively into that issue because we want to resolve the issue of what does the law of the land, what does it state, and what does the rule of professional ethics say. The law of the land does not allow any public officer to do anything other than farming, and so that committee will make appropriate recommendations to government.
Council has also placed a ban on private practice for medical doctors on the payroll of government. The health minister said it's not a punitive action but an enforcement of existing laws which prevent medical doctors from engaging in private practice when their contracts with the government still subsists.